One child was brought by the mother, and my assistant is taking the case. I was asking the mother. She was telling few symptoms. After 3 minutes or 4 minutes, dham, big sound. My paperweight has fallen on the glass on the table. Fortunately, glass is thicker, nothing happened. I was only thinking retrospectively, had it fallen on the head of my assistant, already lean, lanky, would have died. Big case, I would have been behind the bars, all these things. So, but the mother, always mother is a mother. Aisa nahi karna re, she was telling. We were already on tenterhooks and she was saying. This boy was doing halla gulla in the clinic, and I told my assistant, finish fast. 3-4 symptoms, jo bhi mila le lo, bas, don't ask more. What do we need now? What is the drug? I asked the child, Kon phenke? Mai. 3-year-old boy, and he shouted, Mai. What is his drug? Veratrum. Merxol. Tarantula. He was tarantula. Destructive, bold. There is a little difference between tarantula and tuberculinum. Tuberculinum child also does this type, but destructive, but mischievous. Will not accept till he is cornered. The child, had he been tuberculinum, when I asked, Kon kare aisa? Kon? Mummy, tum phenke? So he would ask. Because tuberculinum is over intelligent and doesn't want to take up the responsibility. He knows it very well, tuberculinum child, that everybody has understood the child has thrown the paperweight onto the table. But yet will not accept. Tarantula, मैं ऐसा बोल दिया, क्या करते करो. So likewise, we can make out by observing a person, maybe even in the waiting hall. One fellow was talking to the other patients. That I could observe him by chance, because I happened to go in a different way for a different purpose, not with spying idea, but somebody called me, something happened, so I went there. This man was telling the other patient, ये क्या है? टोकन नंबर्स देते इतना टाइम वेट करना है क्या? ऐसा क्यों? पूछ लो ना, तुम सब लोग पूछो, क्यों बैठना ऐसा? ऐसा वेट करे तो अपने को टाइम रहता है, अपने को बहुत काम रहते हैं, वेट क्यों करना है? Then I marked that fellow. Okay, he came in and I said, when did you come? Just now. Had you waited for long? No. Patients have to wait, sir. No patients. No, that is okay. What is he? Lycopodium. This is what like. He instigates others and escapes. He is coward, timid, and wants the works to be done by others. And he is also afraid that if he is marked by the physician may not give a correct remedy. But as he behaved, we could give a correct remedy. So likewise, you can observe the behavior even in the waiting hall, while coming down, all these things. One, parents came in, entered. And what do you expect usually when the child is coming along with the parents and the treatment is for the child? Child will follow the parents. But this child, may I come in, sir? Come in. Okay. Came in. Then the parents sat in those two chairs and she said, can I sit here, sir? Child of 4th class or so. Okay, sit. Thank you, sir. So I asked a few questions and the parents told about the history, all those things. Over. That's all story about the symptoms. Forget about the symptoms. Now we need to understand the nature of the individual. Then I keep asking most of the children, I asked, are you a good girl or bad girl? Sorry sir, I can't tell that, you have to tell it sir. How can I tell about myself sir? Almost all of the children would say good girl or bad girl, good girl. Sudden, small children. But she is telling, no I can't tell sir. Okay sir, thank you very much sir. Who is she? Ignitia? Carcinosin nearer. You are nearer to it. Phosphorus. The most mannerful people in our Materia Medica, phosphorus. Highest manners. Can be. Pulse can be, but pulse has a lot of negativities. Pulse wants attention. Pulse would never ask, may I come in? Would come in, uncle, can I sit here? And if my parents are telling, she would ask that attention. That is a different aspect of pulsatilla. Pulsatilla comes closer to phosphorus in behavior, because pulsatilla wants recognition, attention. Everybody should say, you are good, you are great. Sepia wants only recognition. Enough, you say, enough for sepia. Sepia need not be bad, oh, nothing. Enough. That is what like difference. Anyway, so likewise, he has given that. And what is the role of constitution? Why do we need to understand the constitution of an individual? If this is one example, like you have treated an acute totality of an individual, and if the acute totality is recurring, for example in a child, frequent attacks of cold, Heparsulf you have given, child is better. Next time child came, maybe Heparsulf, maybe Maxol, whatever is it, child became alright. But it is recurring. Now try to understand the constitution of a child, treat the child so that the child will not fall sick so often or never again. Likewise, any problem for that matter, a young girl having dysmenorrhea, you have given xanthoxylum, Medfast, Nux vomica, some blah blah blah. The girl is happy. Textbook of gynecology says the best treatment for dysmenorrhea is marriage. That is textbook. So, but you can't force all the girls to get married. No. I give for only this 1 month, next month you get married. Nobody will come to you. So likewise, there we need to definitely treat them completely permanently, as permanent as possible. That you need to understand the constitution of that particular individual. They behave differently when they are sick, but their behavior by and large would be guided by their constitution, whether they are sick or they are healthy, whatever they are. The mother is scared to talk to the girl during menses. I asked the mother, other times she is not at home. No sir. The answer is different. Means she is scared even other times, but usually she goes to college other times, but during dysmenorrhea she is at home and the mother is fried on the pan. So that is what like we can understand, we can fortify. Now we will see few cases. What we have to take: dysmenorrhea, some qualities whatever being expressed by the patient, and heavy clotted bleeding. Young girl. And if you have some characteristic features pertaining to that, you may. Steadily she became aggressive. This is one factor. There is a change in disposition. She has become aggressive. Not that she was docile earlier, but more aggressive than ever before. Irritable, started beating her own brothers for simple reasons, without reason or rhyme. Both of them are younger to her. One is an engineer, the other is, MBA in Central University or something. And she used to like her pet a lot. Now, of late, for the past few months or so, started hating the pet, even the pet dog.